Coming up next on Arizona Horizon, a comparison between Medicare and Medicare Advantage plans. Also tonight, what a La Nina weather pattern could mean for Arizona's winter forecast. And a nonprofit looks to destigmatize the homeless. Those stories and more next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your public television station.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. For many Arizona seniors, the choice between original Medicare and Medicare Advantage plans can be confusing. While Advantage sounds like a benefit, the Arizona Hospital and Healthcare Association is warning patients that Medicare Advantage may not be an advantage at all. Anne-Marie Almadine is president and CEO of the Arizona Hospital and Healthcare Association, and she joins us now. Good to see you again.
Good to see you.
Thank you for being here. We're going to get basic here, okay? What is Medicare?
Medicare is a health insurance program that Americans are entitled to when they turn 65.
Okay. Medicare includes Parts A and B?
Yes.
True?
It does.
And what are Parts A and B?
It's hospital and then physician networks.
Okay. Is it a fee-for-service kind of a deal?
It is for traditional Medicare.
So Medicare pays for parts of the bill and then you pay for the rest?
Yes. Oftentimes people have a supplement with traditional Medicare as well, a supplement plan.
Okay, supplement plan, is that through private insurance?
Through private insurance that will enhance coverage. You pay a premium to get additional benefits in terms of prescription coverage and hospital stays.
So Medicare itself covers necessary health care, necessary supplies, most but not all?
There's Medicare criteria where patients have to meet certain criteria to get coverage for certain conditions. That's all very transparent. Physicians know what that is, hospitals. And so once a patient meets criteria, they don't need to go through any sort of prior authorization process. They meet criteria, they get scheduled, the procedure happens.
How would they meet that criteria? Give me an example of that.
Well, it could be for an operation, say appendicitis.
Yes.
And so, appendicitis is a bad example because that's an emergency surgery usually. So it's not something that, for medically necessary criteria, a good example would be a hip replacement.
Yes.
And so there's degenerative tissue in the bone. You need a hip replacement. You meet certain criteria, you can get scheduled to have that hip replacement. Perhaps there's some rehabilitation that takes place afterwards in a rehabilitation hospital to make sure that patient is able to function at a higher status and ambulate in their home, and so they're able to get rehab services, and then they're discharged. So it's a fairly streamlined process for traditional Medicare.
Okay, for traditional Medicare, no prior authorization, no waiting around, it's all taken care of.
No prior authorizations as a part of Medicare Advantage. There might be a wait in terms of scheduling the surgery, dependent upon other patients who are waiting for a similar surgery, etc.
Medicare, what about prescriptions? What about routine eye care, dental care?
Not a part of traditional Medicare, dental and vision, not necessarily. Certain things may be, but I think Medicare Advantage kind of wraps in a lot of dental, vision. It includes Part A and Part B, and that's managed by a private health insurance company.
I want to get to Advantage in a second here, but I'm still stuck on Medicare. I'm still
Okay.
trying to figure out Medicare. As far as prescriptions, though, that's Medicare Part D?
Yes.
Yes. So we got A, B, and D. I think did we get C in there? No, Medicare Advantage is, okay. All right. It sounds a little confusing even from the get-go.
It is confusing, and I think it's hard when people are turning 65 to really navigate that, to figure out what the best option is for them. Is it traditional Medicare, or is it Medicare Advantage? It's complex, and I think with Medicare Advantage, there's a lot of different private health insurance companies that have different plans with different coverages, with different co-pays. So it is a lot to navigate.
So let's get to Part C, Medicare Advantage. What is that?
Medicare Advantage is where a private health insurance company is managing Medicare for an individual. So you're no longer using Part A and Part B. you're using a Medicare Advantage plan through a private health insurance company that is managing your care. You don't have to meet that Medicare criteria that a traditional Medicare beneficiary would. It's the criteria of that private health insurance plan. That could include prior authorization processes. It can include peer-to-peer review in terms of physicians. So there can be more administrative hurdles to get the medically necessary care that your physician is indicating is appropriate.
But it also it includes vision and dental care.
I think some plans do. Not all.
Not all?
Not all. But
Okay.
many plans do.
Prescriptions?
And prescriptions.
Okay, so I'm trying to figure out the benefit of Medicare Advantage, and it sounds like there are some benefits.
Yeah, I think from a consumer perspective, it appears as to be more streamlined, where that you're kind of combining all of the different services into one package.
These are HMOs and PPOs?
Yes.
And what are those?
Well, you can have a broader network through a PPO or a more narrow network in HMOs. And I think the networks are also very different. For traditional Medicare, that's one of the broadest networks any person could be a part of. Almost every hospital, many physician offices are part of Take Medicare. But in Medicare Advantage, the networks are much more narrow. So I think it's really important, if people are considering Medicare Advantage, to talk with their physician and make sure that their physician is a part of that network. I think it's even more challenging if you live in the rural parts of Arizona, where the networks are even more narrow, to make sure that you can go to your favorite physician and you can go to your favorite hospital as you have through the years.
In terms of cost, are they similar, or everything seems to depend on the plan with Medicare Advantage, doesn't it?
It does. It does. There's very different premiums and throughout different types of Medicare Advantage plans. So you really have to, I think, be buyer beware as you're evaluating this. And I think there are a lot of brokers out there that are making money from selling certain insurance products through Medicare Advantage. And so you need to go to, have a trusted family partner and make sure that they're helping you navigate this. There's also state resources like the Arizona State Health Insurance Program, azship.org. They are a neutral party, and they can look at networks and look at benefits and really try to help you in an unbiased way, try to find the plan that's best for you.
Yeah, because if you have a couple of doctors that just simply will not apply to certain programs on Medicare Advantage, Medicare might be better, but then again, Medicare Advantage might be better because you can get certain price breaks, and you can get the vision and dental care come along.
Exactly.
So they will be able to look at your plan, look at your physicians, and say, we think this one might be a little better for you.
Exactly.
Are the hospitals seeing patients come in who have absolutely no idea what's covered?
I think that's very frequent, absolutely. I mean, healthcare is incredibly complicated, from Medicare to Medicaid to commercial insurance plans. I think patients are often confused. And I think there's a lot we need to do to try to streamline the system and make it more patient-centered and patient-friendly and affordable.
You mentioned with Medicare you can get supplemental. That's again through a private insurer. Medicare Advantage is through a private insurer from the beginning. Can you get the supplemental there, or is the Medicare Advantage it?
Medicare Advantage is it. It would not require a supplemental program, a supplemental plan.
So for viewers watching right now, and the last question, I hope I made sense of all this. What is the most important thing to know? Is it basically to know your doctors, know what you need, and just compare and contrast?
I think the most important thing is to do your homework and really for buyer to beware that Medicare Advantage may seem more streamlined. And if you're a healthy 65-year-old and you feel like you know what your medical conditions are, that's great. But as we all know, things happen. Traumatic injuries happen, strokes, heart attack. And if you're in a hospital and you're wanting to have sort of a transfer to a rehabilitation hospital that is at higher level of care, if you're on a Medicare Advantage plan, they deny those transfers more frequently. So you're at risk of not being able to get the care that your physician is saying is medically necessary. So I think it's really complicated, but I think it's important for people to be educated and to really weigh those issues.
Well, I hope we helped them tonight here, Anne-Marie.
I hope so.
Again, Arizona Hospital and Healthcare Association. Great information. Great to see you.
Good to see you.
On this special episode, Lawrence Fishburne sits down to uncover his roots.
You just met your half-sibling. Oh my God.
And I discover a past I never knew.
Today, I'm giving you the Finding Your Roots treatment.
Tuesday night at 7 on Arizona PBS.
Next time on Benjamin Franklin, Revolution,
Choosing sides means choosing fates.
Diplomacy,
Franklin had a difficult assignment.
and a final cause.
It's the first debate in American history on slavery.
Don't miss the conclusion of Benjamin Franklin.
Wednesday night at 8:30 on Arizona PBS.
Arizona PBS and ASU's School of Civic and Economic Thought and Leadership bring great minds together in the Civic Discourse Project. From civic leaders to top scholars, hear conversations that challenge us through civil dialogue while tackling history, politics, race, and other issues shaping America today.
El Niño weather pattern this winter. That usually means warmer and drier conditions for the state and the region, but that's not locked in stone. Indeed, it's possible that La Nina could bring more rain than normal in the coming months. Possible, but not likely. Here to help explain all this is ASU climatologist Randy Cerveny. Randy, welcome. Good to see you again.
Oh, always glad to be here.
All right, so I'm hearing it's a weak La Nina, but it's still a La Nina. What does that mean?
La Nina is a cooling of the Central Pacific Ocean. And when you have that kind of a situation, what it does is it changes the jet stream, it changes the path of storms. So during La Nina, the storms tend to head up to Oregon and Washington.
So they just veer north.
They veer north.
And that means warmer and drier for us.
Exactly.
I think we have a chart or a map here that will show basically what you're saying as far as the forecast is concerned for us during the winter months here. And for the winter months, there you go. It says warmer and it says drier.
Yes, those are the key words. And what happens under this circumstance is that places like Seattle and Portland get it all. And
well, can we go back to the map? I barely got a chance to look at that map. Let's go back to the map again, because it shows how the southern areas, there we go. The southern areas are warmer, but look up north.
Yeah. They tend to get cold air coming down from Siberia and northern Canada that plunges down into the central parts of the country.
So that's like Chicago, Milwaukee, the Midwest. They're in for it, aren't they?
Under normal La Nina, as you point out, it's not written in stone.
How do you know what kind of a La Nina we're going to have?
We don't. That's the trouble. We still are learning about this. Basically, this kind of a pattern right here sets up about 66% of the time. About 2/3 of the time when we have La Nina, we have this. The other third, though, we can have kind of a random dice throw. And if you remember, a few years back, we had a La Nina where we got dumped on during the wintertime. So this is the likelihood, but it's not set in stone.
And again, what time of the year are La Ninas and El Ninos determined? Is it the summertime? Is it now? Is it the when?
We can now forecast these things about 6 months ahead of time. So what we are looking at is a good chance that we will have La Nina as we move into the wintertime.
Okay, that other chart that we saw, what was that all about?
That was actually showing you our forecast ideas for the next 6 months. So you can see that as we get into October, December, the months are down at the bottom there. There's a greater likelihood that we're going to be moving into the lower part of the chart, and the lower part of the chart is La Nina. If we get up into the higher parts of the chart, that's El Nino, and that's where we tend to get really wet summers, or wet winters.
Yes.
And what you can see there is that there's no lines in the upper part of the chart.
Yes. Does it ever change? Is it ever like you look at this chart and you say it's really, and then it actually flip-flops and all of a sudden the temperature in the Pacific changes?
Not that quickly. I'm afraid not.
Yeah.
So this is pretty well, as you can see, there is uncertainty about it, and exactly how strong the La Nina is going to be is uncertain depending on what computer model we run. But all the models are suggesting that, yes, the Pacific Ocean is being colder than normal.
Real quickly, before we get to the big hurricane that's happening right now, we had a couple of hurricanes come up the Baja coast and everything, and we certainly got the last one. This was Priscilla, I think it was.
Yes, and Raymond. They combined their moistures.
Yeah, call them. I got another name for Priscilla, but still, a lot of damage, a lot of rain. La Nina or those weather patterns impact those storms and where they went and what they did?
Well, the idea is actually that was monsoonal. Even though traditionally monsoon ends at the end of September, we were getting that still southerly flow, and it just happened that we had 2 hurricanes that were down there. That southerly flow picked up the moisture and then drew it right up into Arizona. The microburst that happened over Tempe is not anything that's related to El Nino or La Nina. It was just the atmosphere was poised, and it just, unfortunately, dice roll happened right over Tempe.
Yeah, it sure did. Let me tell you, it really did. All right, last question as far as this is concerned. Does the La Nina end at a certain time? The warming temperatures, they start summerish, whatever. How long do they go? How long do you monitor?
We have had weird situations where La Nina or El Nino have lasted as many as 4 years. Back in the 90s, we had 4 consecutive years of El Nino. So it's weird. Normally, La Nina or El Nino is only going to last a year or so, and then we flip-flop and we go into to the alternative. But Mother Nature likes to throw us a weird turn every so often, and we'll have to wait and see exactly what's going to happen with this one.
Yeah, all right. I know that everyone's waiting to see what about Hurricane Melissa over there by a Category 5 storm. Holy smokes, that's about as big as it gets, isn't it?
Yeah, this is a picture of it this morning, and notice how small that eye is.
Yes.
That is an incredibly well-defined and small eye. Actually, I was talking with one of the hurricane hunters that were flying through it today. They saw birds in that eye. This is a picture of what the eye of Melissa actually looks like. We get what we call the stadium effect, where we have a ring of thunderstorms that are completely surrounding the eye, and the eye is actually a fairly calm place.
Right.
Well, birds have congregated in that eye, and the plane actually has to be careful not to run into them because it could hit the engines.
Good luck, birds. I mean, they got to get out of that eye somehow, huh?
They're probably not going to survive because they will get too tired and fall down to the ocean.
Can we go back to the satellite photo of the eye?
Sure.
And I want to see that again. I mean, that looks to me like a perfectly formed storm.
Yes, and the bigger the hurricane, usually the better defined it actually is. And unfortunately, as you can see, just north of Melissa this morning is that island of Jamaica.
Yes.
And that is going to be where tomorrow morning we're going to be hearing lots of damage.
One of the biggest storms in their history, recorded history, if it stays at Category 5.
Indeed. They've never, as far as I know, they have not been hit by a Category 5 hurricane anywhere in their past, in their recent past. This, by the way, is the 3rd Category 5 hurricane we've had this season. May seem like it's not been that big of a hurricane season, but they've all stayed out to shore. We've already had 3 Category 5 storms. And one other thing that I want to point out.
Real quick.
Yeah.
Go ahead.
The people that are doing all this work, the hurricane hunters and the people at the National Hurricane, they're working without pay right now. Please give them your thanks and appreciation. They are going above and beyond the call of duty.
Randy Cerveny, we thank you as always for your ASU climatological expertise.
I'm Jeff Bennett. Tonight on the NewsHour, President Trump stops in Japan as part of his multi-country trip to Asia focused on trade. That's at 6 on Arizona PBS.
Project Umbrella is a nonprofit that distributes meals and care packages to the homeless in Phoenix. Volunteers also look to create connections with those living on the streets, hoping to destigmatize homelessness. We learn more from the co-founder of Project Umbrella, Rami Sabai. Rami, good to have you on Arizona Horizon. Welcome to Arizona Horizon.
Thank you for having me.
Yeah, a Project Umbrella. What are we talking about here?
So Project Umbrella is a 501c3 nonprofit organization that was started back in 2018 in New York City, and we've slowly expanded to the cities of Seattle, Phoenix, and Austin, Texas this past year. And the essence of our organization is to use care packages as an icebreaker to start conversation with the most vulnerable in our communities, which are the unhoused. And through the years, especially after the COVID-19 crisis, we've seen a rise in those populations. And we try to be there for the most vulnerable, and not just in giving them, something, but also just being a listening ear. And we've realized that goes a long way.
Yeah, I want to get to that listening part in a second because that really is important. But the care packages, what's inside a care package?
Yeah, so the care packages, they'll have hygiene kits, and then along with the hygiene kits, you'll have shampoo, deodorant. Anything from nail files, just something to make somebody feel really clean and feel confident about themselves, because at the end of the day, everyone likes that feeling. And alongside with those, we'll put in seasonal essentials, so depending on the season and the city. So for example, in Seattle in the winter months, we know it can get very rainy, so we'll give some umbrellas, some ponchos, some blankets, gloves, socks, and stuff like that. And Phoenix, we know in the summertime, for example, it gets really hot and the sun's brutal out here. And so we want to make sure everyone's playing it safe, and so we make sure to feed them a lot of hydration, whether that be IV packets, water, and then also do sunscreen. So it kind of just varies on the season and the city. We'll also always include socks, stuff like that. So.
And so the volunteers also listen, as you mentioned, they listen and they share stories with some of these folks. How important is just listening?
Yeah, so I mean, like I said, the essence of our organization is just to create that conversation, because at the end of the day, we're looking to destigmatize the idea of the unhoused communities. We want to bring a sense of rehumanization back to these people, because so many of them, feel like they're forgotten, and they feel like people walk past them on the streets and don't even notice them or acknowledge them anymore. So I think sometimes that conversation is just so incredible and so it's lasting for them. So it's a focal point of what we do.
What are some of the stories that you've heard over the time you've been involved?
We've heard so many incredible stories. We've met people that have had degrees, not just one, but further master's degrees, PhDs, and just had a couple bad months, and fell into a hole and unfortunately ended up on the street. We actually just met somebody yesterday at one of our distribution events. So we had a distribution event yesterday in Phoenix and also in Austin, Texas.
Wow.
And met a very incredible gentleman. His name is Mike, and sat down with Mike for about 30 minutes, almost half the distribution time, and we just listened. And he had such an incredible story. He's an ex-Marine. He's a veteran, and he's 66 years old, and he's out on the streets, living on the streets. And he explained some struggles, but he's very grateful for what he's had, and all the resources that we were giving him. And so, he's very intelligent. He told me that he has a Quora blog that he often goes on. I gave him my email, I gave him our website, and actually just this morning he reached out to us.
Very good.
We had nice conversations, and he showed me his Quora blogs and everything. So
very good. As far as meals are concerned, first of all, how much are they included in these care packages? And secondly, where do you get the food from?
Yeah, so the meals were a nice little touch we started integrating into our care packages, just because oftentimes when we hand out the care packages, people would always ask for food. And so from that, we just, we're able to adapt. Like everything we've kind of done with this organization, we started from a grassroots, organization to now, working with a bunch of different organizations and companies around the United States. And so we'll reach out to local restaurants, businesses that are willing to donate some meals, and we're so grateful for everyone that's done it. We have worked with a couple restaurants around the valley. Arrivederci Ristorante was our latest sponsor yesterday on Scottsdale and Thunderbird. They're a great help. We also work with Eric Yee down at Kyoto in Scottsdale. He's a great help, and Jeremy up at OEB Breakfast in Scottsdale. So they're all great helps in helping us fundraise and getting meals.
What about, I know that Project Umbrellas around the country here. Are there some chains and stuff like that that are involved as well?
Yeah, so we have more of our corporate donors such as Costco, CVS, Starbucks, and they've been a great support throughout the years, especially Costco's being up in Seattle.
Now, the goal here is, again, to lend an ear, obviously, to help out, but also to listen, to acknowledge, and just have a simple conversation. But is there also a way that this can help get these folks off the street? I think that's what most people are concerned about when they hear about folks that don't have a home.
Absolutely. And our biggest thing is to create that awareness. So what we'll do is when we meet these people and we hear these incredible stories, we always ask for permission, you know, if they're open to letting us post their story online on our blog. And oftentimes they're more than happy to, and we'll take a photo with them, we'll write down their stories and post them, and they got a lot of engagement, and that's what we hope the engagement, not just for our organization, but just for government officials and other officials around the lawmakers that are making these decisions and can really have the power to make a difference.
Okay, where can people find out more?
So you can find all our information. We're on social media. We're on Instagram, Facebook at project.umbrella, and then we have our website projectumbrella.org. And you can reach out through there and donate and do all the fun stuff. So
you guys see expansion here pretty soon, you think? More cities?
That's the goal. That's the plan. I mean, anyone that's open to expanding, and if they're legitimate drive, we're open to expanding.
All right. So. Well, great work. Rami Sabai, again, Project Umbrella. Congratulations on your success and continued success.
Thank you very much. It means a lot.
And that is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.